it could potentially continue to spread, and the way we prevent that is through vaccinations, and we recommend everybody getting vaccinated.
Dr. Stephen Weisholz is chief of infectious disease at Englewood Hospital and Medical Center, and while no case of measles has come into this lab to date, he says we should be concerned about the outbreak that started at Disneyland in California and has now reached the East Coast.
The individuals who are most vulnerable are the very young, infants and young children, and perhaps the very old. Pregnant women also are of concern.
The measles virus was eradicated in the U.S. 14 years ago, and because the vast majority of the population had been vaccinated. But travelers to and from other countries have brought the virus back, and people, particularly children who've not been vaccinated for whatever reason, are at risk.
If you were born after 1957, then it's probably reasonable, unless you have a clear documentation of having the illness when you were a child, it's reasonable to see your doctor.
Depending on the state, parents can opt not to vaccinate their children for various reasons, including religion. Here in New Jersey, the state health department determined that counties with the largest number of children exempt for religious reasons include Hunterdon, Morris, Monmouth, Sussex, and Warren. This parent says the risk is too great for any exemption.
It's important to get the kids vaccinated. I think that not doing it will expose other children,
It'll be at least another week to 10 days before health officials here in New Jersey get back the lab results that will determine for sure whether or not that one-year-old child in Jersey City did, in fact, have the measles. That child has recovered. In the meantime, though, they are urging people to get vaccinated, and they say if you're too young to get the shot, your child is too young to get the shot, just try to limit their exposure to crowded places like malls and theme parks where they could come in contact with that virus. And if you fall in that 1957 mark, check with your doctor, because there's a very simple blood test you can get to determine if you're immune or not. In New Jersey tonight, I'm Pat Battle, News 4, New York.